Now with day 2 of our series, CEO of Your Health, all about how to invest in your own health the same way a CEO invests in their company. Yesterday was all about preparation. This morning, advocacy. And our chief medical correspondent, Dr. Narula, is back to help you feel empowered once you're in the doctor's office. So yesterday we told you what to do before. Now we're going to tell you when you're in the doctor's office. And there was something that I saw. What was the CDC said that something like 40 million Americans haven't seen a doctor in the last 12 months. The primary care physician, you say that is the quarterback of your care team. Why is that so important?
That's right. Yeah. So, when we think about a CEO, what do? They surround themselves by a good team. And the leader of your healthcare team is your primary care doctor. They are the quarterback. They are the ones that see all of your different problems together as one. They see you as a whole. So they're not just seeing your heart or your gastrointestinal tract, they're seeing everything. They're the ones that know all of your medications and can look to see, are there any interactions between your medications? They're paying attention to that. They're the ones that see a lesion or a mole on your skin and maybe know if it's changing, or they can tell if your mood is down because they've seen you year after year. So they're really, really important. They're also the ones that talk to you about prevention and screening, so mammograms, colonoscopies, pap smears. They're the ones that are going to refer you to specialists, Robin. So if you need a cardiologist or an oncologist, they're the ones that are going to really shuttle you there. It can be really hard to find a good primary care doctor. I get asked a lot. So specialists can be a good source of referral, as can family and friends, your insurance company. And one point you were just talking about earlier is it's nice to have a primary care that has a network of specialists that they are connected to within a health system, because lots of times you will message back and forth. So I will get a message from the primary care doctor saying, I want to do this to your patient, is that okay? Or I will message the primary care. So again, we're all connected. We're seeing the patient as a whole, not fragmented.
And I just told you that I reached out to my primary care physician because one of the specialists within the system has recommended something, and I want to check with her first because I'm not so sure. Advocacy, advocacy. We talk about that over and over again. Come on, give us some doctor's orders and how we're able to do that.
Okay, so first thing is you should read up on whatever your health condition is. You should go on the internet and learn. So a lot of the good sites you can go to, so for example, the American Heart Association, the American Cancer Association, the American Academy of Pediatrics. Understand your diagnosis, learn about the symptoms and the treatment. That's going to be empowering. You and I have talked about health tech, so things like the Apple Watch, the Oura Ring. That can also empower you with information about your own health that you can bring into the doctor's office. Trusting your symptoms, Robin, this is a huge one. I hear a lot of women dismiss or downplay their symptoms. They say, my chest pain is just stress. Don't let a doctor let you feel like they're dismissing your symptoms. So I've also seen patients come to me and tell me, my doctor told me that my palpitations were anxiety when in fact they had a real heart rhythm issue. And yesterday we heard Lindsay Davis say, don't suffer in silence, right? These are really important. If you have a medical mystery, you're not sure what your diagnosis is, or you have something that's kind of niche or particular, think about going to an academic medical center for your care, where they're really going to see a high volume, they're going to see the strangest of the strange. They are going to be able to, again, to figure out what might be going on and really give you the best treatment. And the last piece of advice is use your voice. Yesterday, one of my patients told me she thinks a lot of patients are timid, and that can be so true, right? So if you, for example, had blood work or labs done and nobody's called you back with your results, call and say, I want to know my results, right? If you're in the emergency room, as I was with a family member, and they were suffering in pain, go out and say, please come and help them. You need to speak up.
How do you go about speaking up for yourself sometimes? Because it's really hard for folks to do that. And sometimes something's not really sitting right with you, what you've been told.
You have to use your voice. And sometimes, Robin, you have to get a second opinion, right? So medicine is gray. A lot of people think it's black and white. You can have the same pathology slides and take it to 3 different doctors and get 3 different diagnoses. You can get 3 different recommendations for treatment plans. Medicine sometimes has a different approach depending on who you see. Really important. If you don't feel like something's sitting right, get another opinion or a third opinion.
I know some people are watching that go, I don't have health insurance, I don't have a doctor, but there are services that people can go to.
There are, and community health centers can be a really good resource for people.
That's right, community health centers. Thanks for that, Dr. Narula. And you can scan the QR code on your screen right now to get Dr. Narula's checklist. You got a doctor right here for being the CEO of your health. Tomorrow, I really love this for our series. We're focusing on execution, how to put your doctor's orders into practice and make your health sustainable long term. I really love this series and what we're doing for folks. Dr. Narula, thank you.